So I treated him for 5 minutes on a 2-inch by 4-inch by 8-inch long piece of foam. And that was placed under the back of the left sit bone, also called the left ischium. And the pube is a very strong joint, very thick fibrocartilage. And there's a technique of pubic popping that people use, a muscle energy technique. And that creates a vacuum sound inside the tendon sheath of the adductor longus muscle. It doesn't really establish symmetry of the pubic joints. For this pattern, it requires 5 minutes of prolonged force on a fulcrum. And earlier, at the lower pube, he was posterior on the left, and he no longer is. Let's have you lie on your stomach. Take this thing out. And the left ischium, I can now take up the slack, and I can now spring that. Okay? So we have restored mobility, normal positioning and normal mobility in the pubic joint. I'm going to proceed now to treat attempting to move the lower pelvis on both sides to the right. Let's have you lie on your back. And let me check my camera angle. I don't have my video person here today. So what I do is I cross, he's laying on his back, and I cross the right leg over the left. And I stabilize the right thigh. And then I just pull the left leg to the right, and I do that for 2 minutes. And then I treat the right leg by stretching the adductors, taking the hip laterally, and I gently take it to an end range, but I also do a little bit of inferior traction while I maintain that stretch. Very gentle stretch. Lie on your stomach, please. Then I bend the right knee to 90 degrees. I block the pelvis because I only want to stretch through the hip and the lower pelvis. And I do that for 2 minutes, stretching it out to the right. Then I bend the left knee 90 degrees and I stretch it to the right. So that's external rotation of the left hip and internal rotation of the right hip. After that, I recheck the tailbone because sometimes the tailbone self-corrects after we improve lower pelvic mobility and position. I always come back and I do retest the springing. Then if the tailbone is still side bent to the left, I put the heel of my hand on the left side of the tailbone. And I'm pushing it to the right very gently for 3 minutes. Then I come over to the ligaments on the right side and I push the ligaments to the right for 3 minutes. So I'm going to go ahead and go through these treatments. And then in our next video, we will film the response to that. And the question that we're asking that we will only know with time, the question is there abnormal tension or compression on the left pudendal nerve where it courses between the sacrotuberous and the sacrospinous ligament? And if we restore normal tone to those ligaments and improve position and mobility of the lower pelvis and the tailbone, will that then allow that pudendal nerve to heal over time? And nerves do take a while to recover from an insult. And that is the unknown, and time will tell. So I'm going to stop filming here. I'm going to go through those treatments, and then I'll come back and film the response to the treatment.